So, hello everyone. Let us discuss about the Inicet exam paper. So, let us discuss the first question. If Hima is, the answer is that is blood in the anterior chamber. Now, if Hima, it is presence of the blood in the anterior chamber of the eye. That is known as epima. So here is a diagram. So suppose patient having an eye injury suffer from epima, that is the presence of blood you can clearly see in this anterior chamber of eye. That is the space that is present between the cornea and the iris. So why does this condition occur? So this condition, it is generally seen, remember, it is generally seen as result of trauma to the eye, such as when there is a direct blow or injury, when there is a direct hit or blow. The second option, so when the blood vessels in iris or ciliary bodies, they are disrupted, it can cause bleeding within the structures. The first condition is hemorrhage within the iris or the ciliary body. So hemorrhage within the iris or the ciliary body, the term we use is, remember, it is intraocular hemorrhage, or we use is intraocular bleeding. The option B is blood in the vitreous humor. Well, the blood in the vitreous humor, as we know that vitreous humor, it is a gel-like substance. The last option is bleeding into the subconjunctival tissue. So here is the bleeding that occurs in the subconjunctival tissue. So bleeding in the subconjunctival tissue, that results in a red patch on white part of eye, that is the sclera, and it is known as subconjunctival hemorrhage, and it typically resolves on its own without any treatment. So that is why here your answer would be blood in the anterior chamber. That is the correct answer of this question. Now coming to the next question. The next question is an elderly bedridden patient who is on liquid diet experience aspiration that leads to respiratory complication. Which lung lobe is most likely affected? Now we know that aspiration pneumonia, it occurs when foreign material such as food or liquid is inhaled into the lungs. So when patient inhale the foreign material into the lungs, that leads to inflammation and infection. And remember that the right lower lobe is most common site for the aspiration pneumonia for the several reasons. Why? First of all, consider the anatomy of the right mainstream bronchus. The right mainstream bronchus, remember, it is larger in diameter and more vertical compared to the left mainstream bronchus. So when the aspiration occurs, particularly in the upright position, the aspirated material is more likely to enter into the right lung and settle into the right lower lobe due to the gravity. Now, the second reason could be the vertical orientation of the right lower lobe. The right lower lobe of the lung, it has a more vertical orientation compared to the other lobes, that make it easier for aspirated material to settle and pool into this area. So due to these anatomical factors, aspiration events, they are more likely to result in aspiration pneumonia affecting the right lower lobe. Now on X-ray, what would you see? And that is important part. First, in the case of aspiration pneumonia, you would see is lobar pneumonia. So this one is the right side, right lower lobe is mostly affected. So sometimes the pneumonia that affects the entire lobe of the lung. So there would be the affected lobe that would appear consolidated, that is filled with fluid and inflammatory cells. Second, you would see the area of opacity. So here you can see is the area of opacity. So opacity refers to the area on the X-ray film when the normal lung tissue, it is not clearly visible. So in the aspiration pneumonia, the area of opacity, it may indicate the region of lung consolidation or inflammation due to the presence of the aspirated material. Other thing that you can notice is the segmental opacification. Segmental opacification refers to the localized area of opacity affecting the specific segments of the lung. Other important sign is air bronchogram. An air bronchogram, it is a radiographic sign where the air-filled bronchi, they are visible within the area of lung opacity. Other important sign is cavitation. So what do you mean by that? Here there would be formation of cavities or hollow spaces within the area of lung consolidation. So that may cause necrosis of the lung tissue, resulting in formation of cavities. So the answer here would be right lower lobe. Coming to the next question, one cartridge of e-cigar contains nicotine equivalent to how many packs of cigarette? Now let us discuss the parts of the e-cigarette. First of all, there is a mouthpiece. So mouthpiece is a part of e-cigarette that user inhale from. So it is also known as drip tip. So this is where the user choose the e-liquid flavor and nicotine concentration. Here they are contained. Second is the heating element. So this heating element, it is responsible for vaporizing the liquid. the e-liquid. So it consists of small coil. So here there is a small coil that heats up when activated and turning the e-liquid into the vapor. Other is there is heating element. Heating element that is responsible for vaporizing the e-liquid and turning the e-liquid into the vapors. Other component is microprocessor. Some e-cigarettes include microprocessor that helps to regulate various functions of the device like the temperature control, power output, etc. And there is a battery. The battery that would provide the power to heat the coil and vaporize the e-liquid. Now what is e-liquid? E-liquid, remember, it is mixture that is used in e-cigarettes. It consists of propylene glycol, glycerine, nicotine, flavoring agent, etc. Now moving back to the question, the one cartridge of e-cigar contains nicotine equivalent to how many packs of cigarettes? The answer is 20. The nicotine concentration in e-liquid is measured in milligram per milliliter and it's 20. Coming to the next question, the inclusion bodies of adenovirus and poliovirus, they are known as, well, the inclusion bodies, they are the intracellular structures that are formed by certain viruses. The inclusion bodies of adenovirus and poliovirus, they are known as Cowdry type B bodies. So these are the inclusion bodies seen in infection that are caused by certain viruses, including adenovirus and the poliovirus. The Negri bodies, remember, the Negri bodies, they are inclusion bodies that are observed in neurons affected with the rabies virus. The Warthin Finkadele bodies, they are seen in measles. The Haynes bodies, remember, they can be seen in glucose 6 phosphate dehydrogenase deficiency. That is what you have to remember for your entrance exam. So remember, Cowdry type A bodies, they are seen in varicella zoster and herpes simplex and yellow fever. And Cowdry type B bodies, they are seen in poliovirus, adenovirus and cytomegalovirus. That is important part that you have to remember for your exam point of view. At what age mesoderms should be extracted? The answer is the mesoderms, they should be extracted as soon as detected on the radiograph. So remember that the mesoderms, it should be extracted as soon as detected on the radiograph. So mesoderms, we know it can cause eruption problems for the adjacent permanent teeth. So early removal can prevent the impaction or misalignment of these teeth. If mesoderms is not removed promptly, it can cause crowding, misalignment, So it should be extracted as soon as it is detected on the radiograph. So leaving a mesodense in place can sometimes cause resorption of the roots of the adjacent teeth. Coming to the next question, the H2 receptors antagonist, that are the H2 blockers, they act on which cells of the GIT? The answer would be parietal cells. So H2 receptor antagonist, they are also known as H2 blockers. They are indeed drugs that are used to block the action of histamine on the parietal cells in the stomach. So binding to its receptor on the parietal cells, these medication reduces the production of HCl. So that is beneficial in treating various acid related GIT conditions like GERD, peptic ulcers, Stillingen-Ellison syndrome, etc. Now remember, the H2 blockers they causes histamine release. So remember, this histamine, it is relieved from enterochromaffin cells in the stomach lining. The binding of histamine to the H2 receptor activates the enzyme CAMP. So activation of the adenyl late cyclase increases the level of this CAMP within the parietal cells. So in this increased CAMP activates the protein kinase. Now activated protein kinase phosphorylates and activates the hydrogen potassium ATPase pump on the luminal surface of the parietal cells. So the proton pump exchange potassium ions from the stomach lumen within the hydrogen ions from the parietal cells, that leads to secretion of the HCl into the stomach. Now, what are the action of these H2 receptor antagonists? The H2 receptor antagonists like ranitidine, famotidine, cimetidine, they binds to H2 receptor on the parietal cells, blocking the binding of the histamine. So there is, by blocking the histamine, that prevents the activation of adenylate cyclase, leading to reduced amount of CAMP. And due to that, there is a decreased production of the HCl. So for the question, the H2 receptor antagonist act on which cells of GIT? The answer would be D, parietal cells. Coming to the next question, plateau-like bony margins, they are seen in which type of bony defect? The answer would be craters. So suppose this one is the normal bone contour, and in the craters there is so this, remember this, plateau stage boning margins, they are seen in the craters. So what are these? These are the concavities in the cleft of the interdental bone that are confined within the facial and the lingual wall. And remember, these craters, they form around 2/3 of all mandibular defect. The interdental areas, they are more prone to accumulation of plaque and are more difficult to clean. That leads to increased risk of periodontal disease and bone loss. The normal flat or even the concave faciolingual shape of the interdental septum in the lower molars may also favor the crater formation due to the anatomical factors. So the answer would be D, craters. Coming to next question, cholesterol is used for biosynthesis of all except. The answer is thyroid. Thyroid hormone, we know it includes T4 and T3. And these T4 and T3, they play an important role in regulating the metabolism, growth and development. The thyroid hormone, we know they are synthesized primarily in the thyroid gland from the amino acid tyrosine and iodine. So the process of the thyroid formation synthesis, it involves the incorporation of iodine onto the tyrosine residues within the thyroglobulin. The vitamin D, it is derived from the cholesterol. The cholesterol, we know it serves as a precursor molecule for synthesis of the vitamin D, specifically D3, that is cholecalciferol. So when the skin, it is exposed to sunlight, remember, UVB radiation convert the 7-dehydrocholesterol, a precursor that is derived from cholesterol, into pre-vitamin D3. So vitamin D is derived from cholesterol. Steroid hormone, cholesterol is a precursor molecule for biosynthesis of the steroid hormone that includes glucocorticosteroids, mineralocorticosteroids and the sex hormones. So the glucocorticosteroids such as cholesterol, they are involved in regulating metabolism, immune response and the stress response. The mineralocorticoids like the aldosterone, they regulate the electrolyte balance and blood pressure. The sex hormones include testosterone, progesterone. So steroid hormones, they are synthesized in the various endocrine glands including the adrenal cortex and gonads, and they are derived from the cholesterol through series of the enzymatic reaction. The sex hormone including androgens like the testosterone, estrogens, they are synthesized from the cholesterol in the gonads. In a male, the testosterone, we know it is primarily produced in the Leydig cells of the testes, and it is important for development of the male reproductive organ and secondary sexual characteristic. Remember, in the female, estrogen, they are primarily produced in ovarian follicles and involved in regulating the menstrual cycle, promoting the development of the female Now coming to the next question, what is the purpose of using an anterior jig in the complete denture? Now the anterior jig, it helps you to record the centric relation, right? Remember, anterior jig, it is also known as Lucia jig, that is basically a deprogrammer. So that is used to record the centric relation of the mandible. It is a small, typically acrylic appliance. So remember, it is a small acrylic appliance that is placed on the maxillary anterior teeth. Now let us discuss the purpose of anterior jig in the prosthodontics. The primary function is to record the centric relation. So that is important for ensuring the proper jaw alignment and occlusion in the complete denture. So it helps to guide the mandible into the correct position by providing a stable and repeatable point of contact. Apart from that, its role is it is used as a in deprogramming muscles. Other is the jig, it provides a consistent and stable position for jaw. So that is important for recording the centric relation. So it is placed on the maxillary anterior teeth. The patient closes the mouth until the lower teeth, anterior teeth, they touches the jig. So that will encourage the condyle. To move in the centric relation. So the centric relation is recorded. It is made for setting up the dentures. So your answer here would be the Lucia jig. It is used to record the centric relation. Coming to the next question, which organ malignancy metastasize more commonly to the oral cavity? Well, metastasis in the oral cavity, it can originate from the various primary cancers, with most common being the lungs. So why does the metastasis occur in the oral region, and what are the factors that contribute it? So first of all, the process of metastasis in the oral cavity, that includes, the first step is the cell detachment, and there will be invasion. Now the cancer cell, they will detach from the primary tumor and invade the surrounding tissues. So that involves the breaking away from the cell adhesion molecules like E-cadherin and penetrating the extracellular matrix using enzyme like the enzymes are metalloproteinase. Now the detached The detached cancer cells, they will enter the bloodstream or lymph or lymphatic system. So the cancer cell exit the bloodstream or lymphatic system at a distinct site and adhere to the endothelial cells that are lining the blood vessels, and they migrate into the new tissue. So once in the new tissue, cancer cells must survive, proliferate, and form a new tumor. The oral cavity, we know it has a rich supply network of blood vessels and lymphatics that make it a primary site for metastasis traveling around the system to lodge and grow. So what are the primary cancers that common metastasize to oral cavity? The first is they migrate to the lungs, often metastasize to the oral cavity due to the extensive vascular connection between the lungs and the head and neck. So the more commonly metastasis is from oral cavity to the lungs. Coming to the next question, the muscle soreness experienced by a denture patient after wearing denture for a few hours, it is most likely due to the answer is a reduced interocclusal space. So when the interocclusal space it is reduced, it can cause overclosure of jaw that leads to continuous strain of the muscle of mastication, like the masseter muscle and temporalis. So these muscles, they can become fatigue, may show soreness and discomfort. So the reduced space forces the muscle to maintain the mandible is in an unnaturally elevated position that leads to muscle fatigue, soreness and discomfort. So errors in the occlusion such as heavy contact points from the opposing teeth can create pressure points on the residual ridge that can even lead to the soreness. So this shows the importance of maintaining the proper occlusal relationship. Deflective occlusal contact can cause the denture base to shift that may lead to soreness on the slopes of the residual ridge. So that may also exacerbate the muscle fatigue as the muscle they attempt to stabilize the denture. Now the thumb sucking of habit of a child, the face would be, the answer is long and convex. So remember what are the effects of the thumb sucking? So there you will see is the anterior open bite. So the upper and lower front teeth, they do not touch when the mouth is closed. Apart from that, you can see is the increase overjet, maxillary protrusion, mandibular retrusion. Other important feature that it leads to long face syndrome that would lead to convex profile. Now the convexity, it is due to the forward position of the upper jaw relative to the lower jaw. So the thumb sucking habits in children, it results in a long and convex facial profile due to the dental and skeleton changes it induces. So the answer would be long and convex. Coming to the next question, the antibody interaction with receptive site of antigen, it is known as, the answer is affinity. Now first of all, you should know is what is epitope. Epitope, we know it's an antigenic determinant. So it is the specific portion of antigen molecule that is recognized and bound by antibody. Whereas paratope, it is known as the antigen binding site. So it is the part of an antibody molecules that bind to epitope on the antigen. Now what do you mean by term affinity? So the affinity, it refers to the strength of the binding between a single paratope of antibody and single epitope on the antigen. So that will indicate the tightness of interaction between individual antibody molecule and its specific antigenic target. Whereas avidity, it is measurement of the overall strength. Of binding between antigen and antibody, taking in account the multiple binding sites and the multivalency. So the antibody interaction with the receptive site of antigen, it is known as affinity. That is your answer. The specificity, it refers to the ability to detect small quantities of antigen or antibody. It is measure of how effectively an assay can identify the presence of target substance even at the low concentration. So coming to the next question, the inclined plane appliance, it is used for the correction of, the answer is anterior crossbite. The inclined plane appliance, it is used for the correction of anterior crossbite. So this one is the anterior crossbite. It is a condition where the anterior crossbite, it is a condition where the upper front teeth, they are positioned behind the lower mandibular incisors. When the jaw, they are closed. Now what are the things that we can use for the correction of the anterior crossbite? The first of all we can use is the tongue blade. So this one is example of tongue blade. The tongue blade, remember, they are particularly used when a crossbite is observed during the eruption of the permanent teeth, especially in the pre-adolescent patient. The tongue blade, remember, it is a simple and inexpensive appliance resembling a flat ice cream stick. So the tongue blade is placed inside the mouth with the surface contacting the erupting tooth that is in crossbite on its palatal surface. So upon the slight closure of the jaw, the opposing side of the tongue blade comes in contact with the labial part of the opposing mandibular teeth. So this point it will act as a fulcrum, allowing for the application of light forces to gradually correct the position of the erupting tooth. So the forces, remember the force, it can be generated either by rotating the oral part of the blade labially or by holding the blade stiffly and closing the jaw slightly to a tolerable extent. Other appliance that we can use is the Catalan appliance. So inclined plane appliance, it is used for correction of anterior crossbite. So this one is the anterior inclined plane that is cemented on the mandibular incisors. So it is typically associated with non-removable appliances as they are cemented in place. The lower inclined plane, remember, it is constructed at an angle of 45 degree to the maxillary occlusal plane and can be made up of acrylic or cast metal. The other we can use is the jet springs. Or the double cantilever spring, that is also known as Z spring. It is commonly used for correcting the anterior tooth crossbite as it has a double helix between the two parallel arms with the inferior arm extending as the retentive component in the acrylic base plate. Apart from that, we can use other screws. They can be micro screws, mini screws, or medium screws. Now coming to the next question, what kind of coupling of dihydropyridine with ryanodine in skeletal muscle it is seen? The answer is electrical followed by the mechanical. In skeletal muscle, the coupling between the dihydropyridine and ryanodine receptors involves the electric as well as the mechanical signals. So the electrical signals, when an electrical signal such as nerve impulse reaches the skeletal muscle, it triggers the opening of the dihydropyridamine receptors channels. So the opening of dihydropyridine channels allows the calcium ion to enter the muscle from the extracellular space. Apart from that, you can see is the mechanical response. The entry of the calcium from the dihydropyridine receptor stimulates the nearby ryanodine receptors on the sarcoplasmic reticulum. So that is a storage site for the calcium ions to release even more calcium ions into the muscle cells. So remember, this increase in the calcium ions with the muscle cell initiate the contraction process leading to the muscle movement. So the answer is D. Now the muscle that aid or support the movement of other muscle, it's synergistic. Now remember that the prime mover or agonistic is muscle that produces most of the forces at a joint, whereas synergistic is muscle that aids the agonist, whereas the muscle that opposes the action of the agonist is the antagonist, and a fixator is the muscle that prevents from moving. So the answer here is C, synergistic. When a patient has increase in the plasma osmolarity, it will cause increased secretion of which of these? The answer is D, vasopressin. Cortisol, we know cortisol, it is a steroid hormone that is primarily released by the adrenal glands in response to the stress. So while the cortisol do not have some effect on fluid and electrolyte balance, its main role is in regulating metabolism, immune response, and the stress response. So cortisol is not your answer. Anti-natriuretic peptide, it is a hormone that is released by the atria of heart in response to the stretching of the atrial walls, typically due to the increase in the blood volume pressure. So its primary function is to promote the natriuresis, that is excretion of the sodium ions in the urine, so leading to increased urine volume and a decreased blood volume and pressure. So ANP promotes vasodilation that inhibit the release of renin and the aldosterone that helps to reduce the blood pressure and fluid volume. Renin, it is an enzyme that is released by kidney in response to various stimuli like the blood pressure, low blood volume. So its main role is in renin, angiotensin, aldosterone system. So renin catalyzes the conversion of angiotensinogen to angiotensin 1, that is further converted into angiotensin 2, that is a vasoconstrictor that stimulate aldosterone release from the adrenal glands, leading to sodium and water retention. The answer is D, vasopressin. Now remember, the increase in the plasma osmolarity it is detected by specialized cells in the hypothalamus of brain that are known as osmoreceptors. So when these osmoreceptors, they sense an increase in the plasma osmolarity, they stimulate the release of vasopressin from the posterior pituitary gland. Now vasopressin will act on kidneys and cause increased water resorption. Allowing more water to be resorbed back into the bloodstream instead of being excreted in the urine. So as a result, less water is lost in the urine and more water is retained in the body. That helps to dilute the increased concentration of solutes in the blood and hence restore the osmotic balance. So when the plasma osmolarity increases, the vasopressin secretion increases to promote the water reabsorption in the kidney, reducing the water loss in the urine and helping to restore the osmotic balance in the body. So that is why your answer would be D here, vasopressin. Coming to the next question. The post-ganglionic sympathetic cholinergic innervation it is seen in. Well, the post-ganglionic sympathetic cholinergic innervation refer to the release of neurotransmitter that is acetylcholine by the post-ganglionic sympathetic nerve fibers on their target tissue. In some specific sweat glands, particularly those in areas like palm of hand and sole of feet, the post-ganglionic nerve fibers release acetylcholine. So these sweat glands are known as cholinergic sweat glands. On stimulation, uh, such as in response to increased body temperature or emotional stress, the post-ganglionic sympathetic cholinergic fibers release acetylcholine onto the sweat gland receptors. Coming to the next question, which of following appliance is not example of maxillary expansion device? The answer is pendulum with a Hyrax screw. We know pendulum appliance, it is typically used for molar diphthalization rather than the maxillary expansion, as it consists of a diphthalizing spring that is attached to the maxillary molar. The other options, quad helix, Jones jigs, and Hyrax, all are the example of the maxillary expansion devices that are used in orthodontics to achieve the transverse expansion of the upper jaw. Geometric glossitis is other name of benign migratory glossitis. So benign migratory glossitis, it is a benign condition of tongue that is characterized by irregular appearance or the map-like patches on the dorsal surface of tongue. So the term migratory means changing pattern of these patches which can move or change shape over time. So that is why it is known as a benign migratory glossitis. So the characteristic feature of benign migratory glossitis is the presence of irregular rhythmatous, means the red and depapillated areas on the dorsal surface of tongue. So they appear like a map. So the depapillated area, they will appear smooth, shiny patches surrounded by elevated white borders. So the answer is A here. Another question, the tubotympanic process it develops from, well, the answer is first pharyngeal pouch. So during the embryonic development, the tubotympanic recess extends from the first pharyngeal pouch. So this extension is formed by endodermal lining of the pouch. The tubotympanic recess ultimately give rise to auditory tube, that is the eustachian tube, and the middle ear cavity. So answer is A. Coming to the next question, the thickness of MTA plug in apexification is, well, during apexification, MTA is commonly placed at the apex of the tooth root to create a apical barrier. So this barrier would promote healing and promote the formation of hard tissue, that is dentine, in the root canal space. A thickness barrier of 3 to 5 mm ensure adequate seal and provide sufficient material for the barrier to effectively block the apex. So this range allows for optimal healing and prevent the micro leakage of the fluids and bacteria into the root canal space. So the correct answer is B. So next question is what is the full form of the CRISPR? Well, it stands for the clustered regular interspaced short palindromic repeats. So the answer is A. Now remember that what is it is a genome editing. Remember, it is a genome editing tool that has transformed the field of molecular biology. So it was discovered as part of bacterial immune system where it acts as a defense mechanism. It has a defense mechanism against the viruses. So it is a natural defense mechanism that is found in bacteria and that helps them remember and defend against the viruses. So what does it consist of? It consists of short repetitive DNA sequences interspaced with unique sequences that are known as a spacer. So these spacers, remember these spacers, they are derived from the DNA fragments of the bacteriophages. So when a virus, suppose a virus attack, the bacteria capture a piece of the viral DNA. So this piece, it is inserted into bacterium own DNA in this CRISPR region, creating a memory of the virus. So this region, it is transcribed into long RNA molecule. That this RNA is cut into smaller pieces, that is known as cRNA. So if the same virus attack again, this cRNA guides a protein that is known as CAS to the viral DNA. So this CAS protein will cut and destroy the viral DNA and hence stopping the infection. So the answer is A. CRISPR stands for clustered regular interspaced short palindromic repeats. Coming to the next question, the Salmon patch, it is seen in vascular defects. Now first of all, you should know what is a Salmon defect. What is Salmon patch? Salmon patch, it is their common birthmark. So this region you can see is the Salmon patch. So how they appear? They will appear as a flat, either pink, red patch on the back of neck, forehead, eyelids, or between the eyebrows. So remember, these Salmon patches, they are caused by vascular defects. So specifically, they result from the capillary manifestation where small blood vessels, they are more visible under the skin. Commonly seen on the nape of neck, forehead, eyes, etc. And most of them, they fade. Remember, they fade away with the time. So remember, the Salmon patches, they are benign and they don't require any treatment. So they are not associated with any systemic disease and do not lead to any complications. So Salmon patch, they are benign vascular birthmark resulting from the capillary malformation that are commonly seen in the newborns. So for the question part, the Salmon patch pigmentation, it is seen as a vascular defect. So answer is that. Now coming to the next question, the type of inheritance that is observed in hypohidrotic ectodermal dysplasia is, well, we know hypohidrotic ectodermal dysplasia, it is a genetic disorder that affects the development of skin, hair, nails, teeth and sweat glands. So it commonly affects the hairs, the skin, the hairs, the nails, the teeth and the sweat glands. The most common form of hereditary ectodermal dysplasia, it's the X-linked recessive type. Although the autosomal forms may be seen, the most common form is the X-linked recessive type. That will be your answer. So it will affect the development of skin. So it will affect the skin, hair, nail, teeth and the salivary glands. So gene that is responsible for most common form of hereditary ectodermal dysplasia, it's the EDA gene that is located on the X chromosome. So it will cause hypohidrosis, that is reduced ability to sweat, and can lead to overheating, hypotrichosis, hypodontia, etc. Here you can see is the absence of the hairs, absence of teeth, frontal bossing, hypodontia means missing teeth, hypotrichosis means sparse hair, hypohidrosis means reduced ability to sweat. So these are its key features. Coming to the next question, non-parametric test that is equivalent to ANOVA, it's the Kruskal-Wallis test. So Kruskal-Wallis test, remember, it is a non-parametric test that is equivalent to the parametric analysis, that is equal to parametric ANOVA. So ANOVA, we know it's a parametric test that is used to compare mean across the multiple groups, whereas Kruskal-Wallis, it is a non-parametric test used for the same purpose. ANOVA is appropriate for interval or ratio data, whereas Kruskal-Wallis is appropriate for the ordinary or the interval data. So remember that the parametric tests that are equivalent to the non-parametric equivalents, for the paired t-test, that is equivalent to Wilcoxon rank sign test. Unpaired t-test is equivalent to a non-parametric Mann-Whitney view test, and one-way analysis of variance, that is ANOVA, it is the parametric test is equivalent to non-parametric equivalent, that is Kruskal-Wallis test. So the answer is A here. Coming to the next question, the paranasal senses can be viewed best by, the answer is water seal. Well, water seal, it's the best projection for visualizing the paranasal senses. So you can see the frontal sinus. These one are the frontal sinus. This one is the ethmoid sinus, you can see. This one is the maxillary sinus. So the best view for paranasal, visualizing the paranasal senses, they are the water seal. So this A radiographic projection is obtained by placing the patient head in position where chin is elevated and allowing the X-ray beam to pass horizontally through the skull. So that helps to visualize the maxillary sciences, frontal sciences, ethmoid sciences. So the answer would be Waters Wheel. In which type of suture material is microbial transmission and the wicking effect evident? The answer is the silk suture. We know silk suture, it is a braided natural material that is commonly used in the surgical procedure. It has certain properties that make it more prone to microbial transmission, and the wicking effect is more common as compared to the other suture material. The silk suture is typically braided, providing spacing between the strands where bacteria can hide, multiply, that leads to multiple microbial transmission. Apart from that, silk has wicking effect, so it carries potentially carrying the microorganism deep into the tissues and hence increasing the risk of infection. So your answer here would be should be avoided in contaminated or dirty wounds where the infection risk is higher. So answer is D. Coming to the next question, adult patient with osteomyelitis of knee joints was treated 2 years back. Now want to go for extraction of asymptomatic third molar. What is the antibiotic coverage pre-medication given? So answer is no antibiotic coverage is given. The pre-medication with antibiotics is not typically recommended for extraction of asymptomatic third molars in the adult if they have history of osteomyelitis of the knee joint that was treated 2 years prior and it is currently asymptomatic. Asymptomatic third molars, they are extracted for preventing or prophylactic reasons or due to the complications like the infection, crowding, and antibiotic pre-medication. It is not necessary. According to the guidelines by American Association of Oral and Maxillofacial Surgeons and ADA specification, antibiotics, they are not recommended for the third molar extraction in a healthy adult patient without underlying medical condition or risk factor for infection. So remember the overuse of antibiotics, they can lead to antibiotic resistance and other adverse effects. So the answer here would be D. Henderson-Patterson bodies, they are also known as, the answer is molluscum contagiosum. So this one is the Henderson-Patterson bodies. So these bodies, remember, they are round cytoplasmic inclusion found in the infected cells, and these are regarded as cellular response to presence of the virus. So these bodies, they are actually after the name of Henderson and Patterson, and they are the characteristic cytoplasmic inclusion seen in the molluscum contagiosum, viral skin infection. So coming to the next question, which neurotransmitter acts as a primary inhibitor in the brain? Well, the correct answer is the GABA. GABA, remember GABA, it's indeed the primary inhibitory neurotransmitter in the brain. Now it works by binding to specific receptors that are known as GABA receptors. on the surface of the neurons. Now we know that the GABA, it is relieved from the presynaptic. The GABA, it's relieved from the presynaptic neurons into the synaptic cleft. That is a small space that is present, a normal gap between the neurons. The GABA will bind to the GABA receptors on the post-synaptic neurons. And remember, there are two types of GABA. One is GABA A receptors and other is GABA B receptors. Now GABA binds to GABA receptor on the postsynaptic neurons. The GABA A receptors, they are the inotropic receptors, meaning they are directly linked to the ion channels. The GABA B receptors, remember, they are the metaprotopic receptors, meaning they work through the secondary messenger. When GABA binds to GABA A receptors, it causes ion channels to open, allowing the chloride ion to flow into the neurons. The influx of chloride makes the inside of the neurons more negative and hence hyperpolarizing it. So this hyperpolarization makes it less likely for neurons to fire an action potential and thereby inhibiting the neuronal activity. Similarly, there are GABA B receptors. So when the GABA B receptors, when GABA binds to GABA B receptors, it activates the G-linked G proteins, and it can cause opening of the potassium channels, allowing potassium to leave the neurons. So that can lead to opening of potassium channels, allowing potassium ions to leave the neurons, making inside more negative. And additionally, it can inhibit the calcium ion channels, reducing the release of the neuroreceptors. So your answer is GABA receptors. Now coming to the next question, the chest compression rate in adults is, well, remember, in adults the ratio is 30:1. That means 30 chest compression are given, followed by 2 breath. Remember, in children this ratio is 15:2. So this is used when there are 2 rescuers. In a newborn, the ratio is 3:1. So the answer is 30:2. Coming to the next question, the local anesthesia with highest tissue irritant potential, it's the bupivacaine. Remember, bupivacaine is indeed associated with high risk of tissue irritation compared to some other local anesthesia. Remember, bupivacaine, it is, remember, potent, long acting local anesthetic that often require prolonged anesthesia. So bupivacaine, remember, it is more potent than many other local anesthesia. It has a longer duration. It can provide anesthesia up to 6 to 8 hours, making it suitable for the lengthy dental procedures and controlling the post-operative pain control.
While the bupivacaine, remember, it is highly effective, it has a higher potential for tissue irritation and neurotoxicity compared to the other local anesthesia. So bupivacaine, remember, it should be used cautionally, used in with caution with the patient with the cardiovascular risk, liver dysfunction, or hypersensitivity to the amide type local anesthesia. So the main factor that you have to remember is bupivacaine long duration and high potency make it as an invaluable tool in the dentistry. So your answer is bupivacaine. FT segment elevation in lead V1 V4 of the ECG during myocardial infarction is typically due to the anterior wall. Remember, the FT segment elevation on ECG represents the period between the ventricular depolarization and repolarization. So lead V1 to V4 typically represents the anterior wall of the heart in standard 12 lead ECG. Now FT segment elevation in a lead V1 V4 is characteristic of anterior wall myocardial infarction. So that suggests the ischemia of the heart involving the anterior portion of the left ventricle, that includes the left anterior descending coronary artery. Now this artery primarily supplies the anterior wall of the left ventricle. Coming to the next question, which of one is not reabsorbed along with the sodium in proximal convoluted tubule? It's the answer is urea. In proximal convoluted tubule, the sodium is reabsorbed along with several other substances. Glucose, remember, it is resorbed by sodium glucose co-transport. Sodium and glucose are reabsorbed together in the PCT through process that is known as secondary active transport. Amino acids, they are resorbed by the sodium amino acid co-transport. Similar to glucose, sodium and amino acid, they are reabsorbed together using the secondary active transport mechanism. The bicarbonates, they are reabsorbed indirectly through the action of carbonic anhydrase. Urea, remember, it is not primarily reabsorbed with sodium in proximal convoluted tubule. Urea reabsorption occur mainly in the collecting ducts and driven by the concentration gradient rather than the direct coupling with the sodium reabsorption. So the answer is C. Which of following impression material is least preferred for pouring a definitive cast for fabricating an indirect restoration? The answer is irreversible hydrochloride. The irreversible hydrochloride, remember, they are not dimensionally stable. They must be poured immediately and are more prone to distortion and are less accurate than other materials. So that is why they are least preferred for pouring a definitive cast for fabricating an indirect restoration. The best treatment for cracked tooth with reversible pulpitis is a full crown. Well, what are the advantages of full crown? First of all, they will provide maximum coverage as well as full protection. So it is best suited for extensive cracks and for teeth that need significant protection and restoration. The resin restoration, they may not provide sufficient strength and support for tooth with significant cracks. Bidirectional splints not indicated stainless steel splint, they are not indicated. The best treatment is the full crown. That is your answer of choice. A hemophilic patient, a hemophilic child with gross decayed tooth require dental extraction. If the factor 8 level is 0.025 IU per ml, then severity of hemophilia is, remember, the mild, the answer would be moderate. So you have to remember, for the mild, the level is between 0.05 to 0.40, and for moderate the value is between 0.01 to 0.05. So the answer is moderate, and for severe it is less than 0.01. So your answer is B here. Coming to the next question, the Lyme disease that is also known as borreliosis. It is an infection disease that is caused by the Borrelia, and it is transmitted through the ticks. So it is also known as Van-Wart syndrome. So Lyme disease, the causative agent is Borrelia. It is transmitted through the bites of exodes ticks, commonly known as deer ticks. Now you will see a bull's eye rash at the site of tick bite. So this rash would expand over time. There will be flu-like symptoms, fever, chills, headache, fatigue. Apart from that, one may consider neurological symptoms, cardiovascular symptoms. Apart from that, arthritis, neurological symptoms, that could be C. So answer is A. Which of following these parts is responsible for declarative memory? It's the hippocampus. Remember, the hippocampus, it is responsible for declarative memory. Remember cerebellum, it is involved in coordinated voluntary movements, balance, and note the declarative memory. The hippocampus, it is important for formation, organization, and declarative memories like the fact and personal experience. So that is why your answer is B. The brainstem, it controls the basic life function like breathing, heartbeat, and it is not involved in memory processing. The basal ganglia, it is involved in motor control and procedural memory and not the declarative memory. So your answer is B here. Which amongst the following is the clinical sign of the traumatic occlusion? The answer is mobility. Well, the tooth mobility refers to the movement or looseness of tooth within the socket. So that occurs when the supporting structures of the tooth, that is the periodontal ligament as well as the alveolar bone, they are compromised due to the excessive occlusion forces, and that is true in case of traumatic occlusion. So the main clinical signs is the mobility. Mobility is the primary clinical sign of the traumatic occlusion because the excessive forces can cause damage to the periodontal ligament that can cause loosening of the tooth. Adhesion, it is due to the wearing of the tooth structure due to the tooth to tooth contact, and that it can result from grinding or clenching habits. While adhesion can be a sign of occlusal issues, but it is not excessive exclusively indicative of the traumatic occlusion and can occur due to the factors like bruxism or with the aging. So clinical signs of traumatic occlusion, the best answer is mobility. The best prognosis for of repair among the root perforation is the, remember the answer is the apical third. Remember, the repairing in the perforation in the apical third of the root typically has a better prognosis. So the apical region, it has a better vascularity and healing potential. That is why repair is usually more favorable, allowing for the better visualization and manipulation during the repair procedure. So that is why the answer is apical third. Coming to the next question, the filtration barrier in the nephron, it is formed by all of the following parts except the answer would be mesangial cells. So remember that the filtration barrier in nephron, it is a specialized structure within the glomerulus that is responsible for filtering blood to form urine. So it consists of primary components. The first are the podocytes. So these are the podocytes. So these are specialized epithelial cells that wrap around the capillaries of the glomerulus. So these have a foot-like extensions. So these have foot-like extensions. These are known as pedicles. So these pedicles would create filtration slits that are important for the selective permeability of the filtration barrier. The second option is filtration barrier. It is formed of podocytes. Capillary endothelial cells. These cells line the glomerular capillaries that allow passage of water and small solutes. The third is the glomerular basement membrane. It is a thick gel-like extracellular matrix that lies between the capillary endothelial cells and the podocytes. So it acts as a physical barrier to passage of large molecules. So your answer would be mesangial cells. So these are the mesangial cells. So these are not part of the filtration barrier. They are located outside the filtration barrier. So your answer would be mesangial cells. Now, which of these is most commonly used in dental anesthesia? Well, the answer is D, 2% lignocaine with 1:1000 adrenaline. We know lignocaine, it is widely used in local anesthesia in dentistry as it is safe and has a rapid onset. The adrenaline, we often combine the lignocaine with the adrenaline to prolong the anesthetic effect, and apart from that, to control bleeding that is caused by the vasoconstriction. The most common we use is 2% lignocaine with this 1:1 lakh adrenaline. So the answer would be D. Bilateral cleft lip, it is due to the defective embryonic fusion of which of following structure? The answer is D, median nasal process with the maxillary prominence. So the median nasal process and the maxillary process, bilateral leads to incomplete fusion, leads to bilateral cleft lip. The 8-year-old child comes with a bilateral TMJ ankylosis. He gave history of excess snoring, continuous waking in night with daytime somnolence, what would be the treatment? So the patient might be suffering from obstructive sleep apnea. So due to the restricted growth and the function of the mandible. Option A, gap arthroplasty. It involves the surgical creation of gap at the site of ankylosis to allow for some movement. So that would not sufficiently improve the airway in the growing child and not address the underlying mandibular deficiency. So it's incorrect. Costochondral grafting. It involves a rib graft to reconstruct the TMJ. It is important for the TMJ reconstruction, but it may not be the best solution for improving the airway function in context of severe obstructive sleep apnea. The answer is C, the mandibular destruction osteogenesis. Here we gradually lengthen the mandible by cutting the bone and slowly moving the two halves apart using a mechanical device. So this method will not treat the ankylosis but also improve the airway by advancing the mandible, so increasing the pharyngeal airway space. So that is why the answer is C. The best treatment for type 3 apical transposition is, well, the type 3, the answer is MTA plug. So there are three types of apical transposition: type 1, type 2 and type 3. In type 1 there is minor movement of the physiological foramen, and in 2 there is moderate movement of the physiological foramen that results in heterogenic relocation and potential communication with the periapical space. And in type 3 apical transposition there is severe movement of the physiological foramen. So these cases require obturation to best possible extent followed by the corrective surgery. So the MTA plug, remember the MTA plug, it is used to create a apical barrier in this situation and prevent a seal that promotes healing and prevent the bacterial leakage. So for type 3 apical transposition, the treatment involves using a MTA plug to effectively create a apical barrier due to the significant relocation of the foramen. The flow rate of a 20 gauge cannula is, the answer is 60 ml per minute. So what are the factors that would influence the cannula flow rate? The first is the gauge size. So the gauge size represents the diameter. Suppose you have a 120 gauge and 18 gauge. So remember, 20 gauge would have a smaller diameter compared to lower gauge number, that is a number 18. So this diameter would affect the flow rate. Larger the diameter, higher the flow rate. Apart from that, other factors that affect is the pressure. Increase in pressure would increase the flow rate. Third is the viscosity. Less viscous fluid like the saline, they flow faster than more viscous fluid like the blood. So what are the flow rates of various gauges? Remember, 18 gauge would have a flow rate of 90 to 110 ml per minute. 20 gauge is 60 ml per minute. That would be your answer. And 22 gauge would have a flow rate of 35 ml per minute. So the correct answer is 60 ml per minute. The ketone body in the plasma increases in condition of starvation and in case of uncontrolled diabetes. So during starvation, what you will see is the body depletes its glycogen stores and starts to break down fatty acids. So that would lead to production of ketone bodies, that is acetoacetate and beta hydroxy butyrate in the liver that are relieved in the bloodstream, and they are used as alternative source by the various tissue including the brain. Other option is uncontrolled diabetes. In uncontrolled diabetes, there is insufficient insulin to facilitate the glucose uptake into the cells. So that lead to increased fatty acid breakdown, and there would be increased ketone bodies by the liver. So the lack of insulin also prevent the inhibition of ketogenesis that result in high concentration of ketone bodies in the plasma that can lead to diabetic ketoacidosis. Option B is well-fed state. So in well-fed state, the body has sufficient glucose and insulin level to meet its energy needs, and that is why no ketone bodies production would be seen. In protein deficiency, that does not typically lead to increase in ketone bodies. So your answer is option A. Coming to the next question, which of following is not rational? The answer is tetracycline with tazobactam. Option A is sulfixime plus sulbactam. We know sulfixime, it is a third generation cephalosporin. And sulbactam, remember sulbactam is a beta lactamase. So this combination can be rational because sulbactam, they can protect the sulfixime from being broken down by beta lactamase enzyme, so thereby extending its spectrum of activity. Tetracycline, we know it's a broad spectrum antibiotic that inhibit protein synthesis by binding to 30S ribosomal subunit. Tazobactam, we know it's a beta lactamase inhibitor that protects beta lactam antibiotic from enzymatic degradation. As tetracycline is not a beta lactam antibiotic and it is not susceptible to beta lactamase, combining it with tazobactam is not rational. So your answer is B. Coming to the next question, the oral malignancies can be seen in, the answer is xeroderma pigmentosum. Well, xeroderma pigmentosum, it is a rare autosomal recessive condition. So that is characterized by extreme sensitivity to the UV lights, resulting in sunburn, frecking, and increased risk of developing skin cancers, including the squamous cell carcinoma, basal cell carcinoma. So they have increased risk of developing ocular lesions and they are prone to develop malignancies. So that is why your answer is T, xeroderma pigmentosum. A patient with pulp exposure has calcium hydroxide applied directly to exposed pulp to preserve its vitality So this procedure is known as direct pulp capping. So here the calcium hydroxide is applied directly on the exposed pulp to promote healing and preserve the vitality. So the purpose of direct pulp capping is to create seal over the exposed pulp to protect it from further infection and the inflammation. To manage perioperative bleeding during surgery, crystalloids they are given in which ratio? Traditionally, remember 1:3 ratio of crystalloid to blood loss was recommended. But according to the current hypothesis, 1:1 is sufficient for maintaining the hemodynamic stability. That means the patient blood pressure and perfusion are kept within the normal range. So remember, lung function is important parameter. Excessive fluid can lead to pulmonary edema that would impair the gas exchange and may cause acute respiratory distress syndrome. So by reducing the volume of crystalloid to 1:1 ratio, it is expected to minimize the risk of fluid overload, and prevent the edema in the lungs. The star-shaped inclusion bodies evidenced in sarcoidosis, they are so remember they are the asteroids body. So the answer is asteroid bodies, they are seen in sarcoidosis. Warthin-Finkley bodies, they are seen in measles. Donovan bodies, they are seen with Klebsiella. So answer is C. So these are the asteroid bodies. The muscle of mastication that causes depression of mandible, the answer is lateral pterygoid muscle. So remember this lateral pterygoid muscle, that is primary muscle that is responsible for depressing the jaw. It pulls the condyle forward and aids in opening of the mandible. So it works by pulling the mandible forward downward, that leads to depression of the mandible. So answer is lateral pterygoid. Next question, the bicarbonates release from pancreas, it is stimulated by the remember the bicarbonate release is stimulated by secretin. So secretin, it is a hormone that is produced by the S cells of the duodenum in response to acidic chyme. So it stimulates the pancreas to excrete the bicarbonate rich fluid. So this bicarbonate would help to neutralize the chyme as it enters the small intestine. Option C, gastric. Remember gastrin, it is hormone that is produced by G cells of stomach. So it stimulates the secretion of HCl by the parietal cells of stomach, and it aids in gastric motility. Option B is cholecystokinin. Remember, it is a hormone secreted by the duodenum. So it stimulates the gallbladder to contract and release the bile. And it stimulates the pancreas to secrete digestive enzymes. The renin, it is enzymes secreted by the kidney that play a role in blood pressure and electrolyte balance. And it does not influence the pancreatic bicarbonate excretion. So your answer would be D. Which of the following features are true regarding the anak? Well, the answer is D. So the answer is bone loss is C, and punched out, this is true, and punched out crater-like lesions, this is true. Nugget is primarily caused by the Fusobacterium, Prevotella and spirochetes, and it is not typically due to the viral infection, so option A is incorrect. Nug can lead to rapid and severe periodontal destruction including bone loss, and one of the hallmark feature is the presence of punched out crater-like lesions on the interdental papilla. While the gingival recession it can occur in chronic periodontal disease, it is not a primary or defining feature of an anak. So answer is D. Next question. A 10-year-old child come after road traffic accident with persistent bradycardia and hypovolemia. There is herniation of orbital content. What is diagnosis? The answer is white eye syndrome. So white eye syndrome, it is typically seen in children after orbital blowout fracture. So you will see bradycardia, herniation of the orbital content. They are indicative of this condition. So there is a trapdoor like fracture of the orbital floor leading to severe pain, and that could lead to symptoms like bradycardia. Which of following cells they are deficient in AIDS? The answer is CD4 cells. So AIDS, it is caused by HIV immunodeficiency virus. The primary target is the CD4 T helper cells. So T cells, by binding to the CD4 molecule on a co-receptors, that is CCR5 or CXCR4 on the surface of these cells. So once inside the cell, HIV uses the cell machinery to replicate and produce new viruses. There would be destruction of the CD4 cells. So the replication process that causes the death of the infected CD4 cells. As the CD4 cells decline, the immune system becomes impaired, leading to the development of the AIDS. Pseudohyphae, they are observed in Cryptococcus. So that is, so the most common presence of pseudohyphae is seen with the Cryptococcus. So Cryptococcus, it is a fungal genus that commonly caused by infection in HIV individuals, particularly with the patient with the AIDS. The fungal cells of Cryptococcus, they are encapsulated yeast cells, and on microscope you would see pseudohyphae. A 25-year-old female with a depression developed a buccal lesion and was prescribed linezolid. Which of following could potentially result as a dry interaction? So when linezolid is combined with MAO inhibitors, it can lead to condition that is known as serotonin. syndrome, that is characterized by confusion, hallucination, rapid heart rate, high blood pressure, fever. So there would be elevated increased blood pressure. That is the feature. So if patient is taking depression and is prescribed lanzolid while taking HO inhibitors, it can result in drug interaction leading to elevated blood pressure that could exacerbate the symptoms of the serotonin syndrome.